Okay, I'm delighted to now open the pharmacy hub here in Newton Stewart.
Yay!
The background to the pharmacy, this hub, is that we are looking at transforming health and social care throughout Wigtownshire, and this is a good example of how relatively simple procedures can actually produce a much better result, which actually eventually will improve patient experience.
I think key for me with the hub has been the teamwork from across the board, from the pharmacy team themselves to admin to working with estates and pulling it all together, and really the teamwork to get this going has been exemplary, and I'm just really proud of the work that everybody has done to bring the hub into the fruition.
So previously the pharmacy team had provided a service into the GP practices, say 1 day a week, 2 days a week, and that was the sole pharmacy time that they got. Now that we've got the pharmacy hubs open in both the Stranraer and in Newton Stewart, we provide a 5-day service to the GP practices, so it means we have increased the support that we can offer them, so we can take more and more work off the GP practices, and it also means that we've got our staff all based in one room rather than being in a room in one practice and a room in another practice. We're all working together and learning from each other.
So this development that we have here within Newton Stewart and the hub model that we now have for pharmacists working within GP practices, that has come from the change in contractual arrangements that GPs have with the NHS. The value and of the skill set that the pharmacy team can bring to providing care for patients to help them manage their medicines better, so that more people are on the right medicine at the right time and taking them more safely. The value of that has really been recognised within that contract. So what we now have are pharmacists, pharmacy technicians, pharmacy support workers and our local community pharmacies much more involved in helping people take their medicines effectively, appropriately, safely, and the value of having such a hub model as we've got here in Newton Stewart means that pharmacy team are all located together right in the middle of the GP practice team as well, so they can work more closely with the doctors and the nurses here. It's a real model potentially for the future, and it's a really exciting time.
I'm delighted to be here at the official opening of the hub here in Newton Stewart today, the pharmacy hub, which has been developed as part of our Transforming Wigtownshire programme alongside our Transforming Primary Care programme through the implementation of the new GP contract. Delighted to meet the staff here today, ranging from our pharmacists to our technicians to our support workers, who will all work as part of that multidisciplinary team to help with the implementation of the new contract, to free up GP time for GPs to be able to focus on the role that's specific for a GP, but also most importantly to improve the patient experience, giving patients access to this multidisciplinary, multi-professional team here within the hub.
I'm really excited actually. The development here is a tremendous piece of work. It's been developed down here in Wigtownshire, and I would think it's got to be a model for the rest of the region when all the learning and good practice is made available to be shared by everyone.